Morning, everybody, and thanks for coming. This is my prenatal class. We've been teaching this class for about 25 years, almost continuously just to my patients. And all of you that are in this room are coming to me for obstetrical care, and all of you are having your first baby. There are no actors in the room. This is a for real class, and it's done in real time. So I have no idea what's going to happen during this class. This is an interactive class. I'm going to be speaking. You're going to be asking questions, I hope, and it's going to be recorded. Don't be shy. Ask your questions if you have some. Don't try to save them. Somebody will always remind me where I am if I've forgotten. This is a class, and everybody's got a memory, and they'll remember exactly where I was and will just wind me up again. Now, like I say, I've been teaching this class for about 25 years, and the class obviously has evolved over that time according to the information that I need to provide for you, and as well the information that you need. So it's changed considerably. I don't show videos anymore. There's lots of stuff on television. There are DVDs. There's all kinds of educational stuff available. But there's nothing like this. This is a class that's given by an obstetrician. This is a real class. It's not given by a nurse midwife. It's not given by an interested person who's been teaching class for a while. It's not a nurse. It's not a physiotherapist. This is a real class. Not to say that their classes aren't useful, but this is a different type of class. When you ask me a question, you're going to get it straight from the horse's mouth, and I'm going to tell you exactly how things are done and exactly how I do them. Now, there are obviously modifications. Other people will do things a little bit differently, but basically, I'm going to talk to you about how obstetrics is really practiced. Okay? Now, everybody's in a different situation. In high school, who did science? Everybody did science? Who did science in university? Nobody. Okay. All right. I'm going to bring you all up to the same level. I will not put it over your head. You're going to understand what I say, and if you don't, I'm going to answer your questions. Okay? So don't be afraid. The class is divided into 4 parts, and each class is going to run for about 2.5 hours approximately. I don't know. It's going to depend on what I put into it and the questions that you ask. And every class that I give is a little bit different because it's done in real time, and I don't know exactly what's going to develop during the class. Once in a while, my pager will go off. I'll answer the phone. Once in a while, I have to leave and deliver a baby. At the moment, I have 2 people in labor upstairs. If I have to go, I have to go. And I will be back. I won't bring back the baby, but I'll probably bring back the placenta. And at some stage during the class, I will bring in a real placenta. We're going to look at it, and we're going to talk about real things that take place. So this first class today is a basic science class. How did we get here? Was it easy? Was it hard? What's developed up till now? What should you anticipate? Why do things go right? Why do things go wrong? So we're going to talk about some basic science today. Next week, we're going to talk about labor. How does it start? How is it managed? What's normal labor? What's abnormal labor? What happens if it's premature? What happens if it goes late? Why do we induce people? How do we induce people? And we're going to talk about pain relief, because that's a really important component of this. You want to know, am I going to be there for the delivery? What are you going to do to make sure that I survive the day? So I think those are the 2 really big issues. And we're going to talk about the labor in real terms, because it doesn't always go exactly the way it's supposed to go. And class 3 is called What If? What if everything I told you in class 2 is a lie? And what if it doesn't go that way? So we're going to talk about all of the what ifs. What can go wrong? What will go right? How do we deal with the things that go wrong? And we're going to talk about all of that. Why do some people end up with cesarean sections? Why do some people need forceps? We'll talk about all of those issues. In the last class, we're going to talk about what happens after I hand you the baby. Baby comes out, I put it up on your tummy, and I say, this is yours. It's not mine. Don't want it. Had mine already. Don't want to do it again. Now what? What can keep you in hospital a little bit longer? What can keep the baby in hospital a little bit longer? What issues are there? What do you need to prepare for? We're going to spend some time talking about breastfeeding, because that's a big issue. We're going to talk about jaundice. We'll talk about problems that happen. We'll talk about pediatricians, and we'll talk about things that you need to prepare for when you go home. Is that fair? Along the way, there will be questions. And if you have your questions during the class, I'll answer them. If you want to save them up and ask them next week, that's okay. I know that when you walk out of here each day, you will talk. You'll talk to yourselves, you'll talk to each other, you'll talk to your friends. And there are all kinds of stories and mythologies about obstetrics. Everybody's heard stories, and some of those stories are great, and some of those stories are terrible. Some of them are true, some of them are not true. It's a little bit like a fish story. You know, you go fishing and the fish was this big, but it was really only this big. And in obstetrics, it's a lot like that. You know, you hear a story saying there was a pool of blood on the floor, and sometimes there is. It's usually half as much as the patient says and twice as much as the doctor says. So the truth is somewhere in between, and we're going to talk about all of those issues as well. Okay? All of you have relatives or friends who have had babies, and they all have stories, and they have prepared you to some extent. They've said this is what's going to happen, and that's going to happen, and you know, there's some fear and there's some anticipation, and we're going to try and resolve all of that. So like I say, this is a real class. We're doing it in real time, and I have no idea what's going to happen as we go along. Is that fair? Okay. So here we go. Human pregnancy is a fairly long pregnancy, 280 days. Calculated from the first day of the last period, we say that a pregnancy is 280 days long. 280 divided by 7 is 40, so it's 40 weeks. And when you're in the office, I'm always saying to you, you're 18 weeks, you're 24 weeks, you're 32 weeks. I'm never saying to you, you're 6 months. We're not talking months at all, because we don't know what kind of months we're talking about. We could be talking about lunar months. The moon goes around the Earth. It goes around every 27.8 days. 27.8 times 10 is 278, and that's pretty close to 280. So it's 10 lunar cycles, but it's 9 calendar months because the months are 30 or 31 days. And so we don't know what kind of months we're talking about, whether we're talking about calendar months or lunar months. So we're not talking months at all, and we always talk weeks. Now, when a pregnancy ends before 38 weeks, we say it's premature. And if a pregnancy goes more than 42 weeks, we say it's post-mature. I'm not going to let anyone in this class, not anybody in my practice, go 42 weeks. And usually, we end the pregnancy somewhere around 41 weeks and a bit, more or less. Sometimes a little more, sometimes a little after, depending on all kinds of things. And we're going to talk about what happens if you get to 41 weeks and you haven't had the baby. How do we deal with it? So we'll get to that point. All of you have a date. Everybody's been given a date. You either calculated a date yourself, or your family doctor gave you a date, or I gave you a date, or the ultrasonographer gave you a date, and most likely you have more than one date. And that tells you right away the dates are wrong. The date is a best guess. Nothing will happen on the day that we've said you're going to have the baby. We've given you a date. Nothing bad happens on that day if you haven't had the baby. It's not a contract. Okay? It's not a contract. It's a best guess. And it's a best guess based on best information. Information you gave me. When was your last period? And we calculated it out based on that information. And then we did an examination, and we saw if the dates fit. So we said, when was the first day of your last period? And most girls can remember that. They write it down. They keep track of these things. Girls keep track of all kinds of stuff. You were good, you were home, you were not home, you had a fight. They write all this stuff down so that they can remember and kill you with it later. Okay? So they keep track. And usually they know when that last period was. On the basis of that, we took out a little wheel and we calculated the date, and we said, here's when you're going to have the baby. Now the problem with that is that it's based on a 28-day cycle. And here we have 12 girls going to have babies. Who in this room has a 28-day cycle? Not one of you has a 28-day cycle, so all of you have wrong dates. So based on your cycle, nobody has a correct date. And all of you have a period, a cycle, which is different than 28 days. It could be a little bit less, 27, 26, and it could be longer, 30, 31, 35. And what's true about the cycle is that it changes. Almost no one has a cycle that's exactly the same all the time. Almost no one. And so it poses a potential problem for people who are trying to get pregnant because they're trying to figure out when they should try. But here's the story with the cycle. Your dates are calculated on a 28-day cycle, and if you don't have a 28-day cycle, your dates are wrong. Most of you, I'm sure in this room, have cycles that are a little longer. They're 29, 30, 31, 32 days, and they change. This month it was 32 days, the next month it was 29, then it was 34, then it was 27, then it was 33 again. It changes all the time, and that's normal. It's normal. The only time that a cycle poses a problem is when it's really, really prolonged, and we don't know whether you're ovulating at all. And it poses a problem for those girls that are trying to get pregnant and aren't ovulating. So here you are. If you have a 28-day cycle, 28 goes into 365 13 times. It means that you have 13 tries to get pregnant in a year. If you have a 40-day cycle, it's not abnormal. It just means that 40 goes into 365 9 times, and you're going to have 9 tries to get pregnant over the year. You're not going to have 13. And it changes a little bit each time. So here's the story with the cycle. There are 2 parts to your cycle. The part before you ovulate, the pre-ovulatory part, and the post-ovulatory part. And in the middle is your ovulation. And the only time it works out to be equal is when you have a 28-day cycle. Because you ovulate, you produce an egg, or eggs as we'll see, about 14 days before your period. So when your period starts, that says 14 days ago I ovulated. And if you have a 40-day cycle, then you may have ovulated on day 40 minus 14, day 26. And if you were trying to get pregnant on day 14 and you didn't, you understand why. You ovulate approximately 14 days before your period starts, 14 plus or minus a day. And you don't know exactly when that's going to be because you have to look backwards. So if you're trying to get pregnant and trying to figure out when to try, you've got to look at all your cycles and say, okay, this one was 40, this one was 37, this one was 33, and count back the 14 days and figure out when that window of opportunity is for you to get pregnant. Okay? Who in this room got pregnant first try? 1 person. 2. Who took more than 3 months? Who took more than a year? Nobody. Okay. Sometimes in my classes I have people who've been trying for years. And you know, it's an interesting thing. You talk to each other usually and you say, we're going to try to have a baby. And sometimes you haven't talked to each other and it just happens, right? I wasn't even trying and here I am. But a lot of times you are trying. And so you talk to each other and you say, okay, we're going to try, and you figure out when your time of ovulation is and you try. And what happens is you don't get pregnant. You get your period. And you're a little bit disappointed. Okay, nothing happened that month. And you try again the next month and you get your period. And you try again and you get your period. And by the time 6 months has gone by and you haven't got pregnant, you're starting to think, right? He's starting to say, she can't have a baby. And she's starting to think, I married a dud. He told me he was a stud, but he's not. But you're not talking to each other yet. You're just thinking. But by the time a year rolls by, or sometimes a little bit less, you're already talking to each other and you're saying, we need to go figure this out. Let's go to the doctor. Us, 2 people, because it's both of you, go to the doctor and figure out what the problem is. Let's see if it's him. Let's see if it's me. Let's see what's going on. In this class, nobody had a really difficult time, and that's great. But sometimes there are problems. And here's how it works. In the first part of your cycle, okay, pre-ovulatory, before you produce an egg, you start to produce a hormone called FSH. follicle-stimulating hormone. Now, before I start into this, let me tell you that we're very similar, okay, you and I. We have the same hormones. You have FSH, LH, TSH, ACTH, you have estrogen, you have testosterone, and I have the same hormones, exactly the same. Except I have more testosterone than you, and my body is more sensitive to it. But if you took testosterone, you'd get muscles. You'd be able to arm wrestle him, and he has big arms. And you would gain weight. And if you took enough testosterone, your period might stop, your voice might change, and you might grow a little bit of a mustache, and he wouldn't like you just as much. But we both have the same hormone, and I have estrogen also. But I have much less estrogen than you, and my body is much less sensitive to estrogen. But if I took estrogen, I would become a soprano. Not one of those sopranos. Well, you know, my voice would change. And my breasts would grow. So I'm sensitive to it also, but not nearly as sensitive as you are. We have the same hormones. In truth, we're not very different at all. And in truth, we all start out as girls. So I can get in touch with my inner girl anytime I need to, okay? So we're going to talk about how that happens as well, all right? The hormone that's most important in the first part of the cycle is FSH, and we're talking about girls now. So FSH, follicle-stimulating hormone, comes from your pituitary gland, which is in your brain, a very small gland about this size, critically important. You start to produce FSH, and FSH goes into circulation, and it acts on your ovaries. There are receptors. And you have, ordinarily, 2 ovaries. Each of these ovaries has immature egg cells. It has little follicles. And if we, for some reason, need to take an ovary out of a 20-year-old girl, and we cut it up and look at it under the microscope, we see thousands of little immature follicles. If we take an ovary out of a 60-year-old woman and cut it up, there are no follicles. You've used up all your eggs. So the interesting difference between us, for starters, is that you come with eggs, I come with sperm, you come with all the eggs you're ever going to have. I keep producing sperm until I die. So girls are born with all the eggs they're ever going to have. When is the time in your life when you had the most eggs? Most eggs. Well, the answer is before you're born. The answer is at about 20 weeks. Halfway through your pregnancy, that little girl that may be inside you is already starting to develop, already looks like a human being. And 20 weeks into the pregnancy, those 2 tiny little ovaries have approximately 4 million eggs. That's all she's ever going to have, 4 million. And by the time that little girl is born, 20 weeks later, 2 million eggs have died. So you're born with approximately 2 million eggs in 2 ovaries. Not bad, 2 million. But the problem is that by the time she starts to ovulate, and that's going to be around age 12 or so. The earliest that I've seen in my office for girls starting to ovulate is about 9 or 10. The youngest girl that I've ever delivered in my office, in my practice, was 12. So this was a baby having a baby. Oh, wow. By the time you start to ovulate, around age 12, most girls start to ovulate around age 11, 12, 13. By the time they're around 14, 15, they're probably the last ones in their class. By the time they're 16, 17, they're starting to worry. And by the time they're 18, mama's bringing her daughter to the office to find out what's going on. Agreed? So around age 12. By the time you get to age 12, 1.5 or 1.6 million eggs have died. So you're now down to about 400,000 eggs, divided into those 2 little ovaries. Those eggs are all you're ever going to have. You're not going to produce any more. Now, let's say you start to ovulate, you start to produce eggs, let's say at age 10. And let's say you're finished, you come to menopause at about age 50, approximately. So 40 years. And let's say that you're going to have 13 periods a year. Let's say you have a 28-day cycle. So 13 times 40, roughly 500 to 600 eggs are going to be necessary over your whole lifetime. So you have enough. 500 to 600 is all you're going to need. You can count them off. Every time you have a period, that's one gone. And what happens is that you use them up as you go along. As you age, eggs die. Whether you use them or whether you don't use them, they're going to die. So the numbers are going to come down anyway. And every time you ovulate, you're not going to use up just one egg. You're going to use up many. How many? We don't know. But many. Many can be 2, many can be 20 or 30. Because FSH that's produced from your pituitary gland goes into your circulation and it targets your ovaries. It doesn't take, your ovaries don't take turn, my turn, your turn, my turn, your turn. They both respond at the same time. Both ovaries are responding at the same time. And if we do ultrasounds, we can see small follicles, little eggs, starting to develop in both ovaries. And usually only one of them becomes what's called a dominant follicle. And it's the one that's going to ovulate. And each month, every time you have a cycle, you get a little cyst on your ovary called a corpus luteum as a result of ovulation. So we do the ultrasound for studying people, and we see these eggs develop. We see how many follicles you've got, whether you have any, whether they're developing to the right size, and once in a while we'll see 2 or 3 that are mature follicles. And usually you ovulate one follicle, usually one egg. Sometimes more than one, so you can have twins or triplets. And if we give you drugs to stimulate you, which we would do with people who have infertility problems, you can have multiple eggs. And multiple can be a lot. And when we have people who have infertility problems and we're stimulating them with drugs, sometimes they can collect as many as 20 or 30 eggs. So a lot. Usually just one. Now usually you just ovulate once during the month. It is possible, and sometimes people ovulate more than once. So that accounts for little problems with dating, and little issues come up with this. Usually it's one. So in a 28-day cycle, and that's what we're going to talk about right now. Somebody's whistling. You produce FSH. FSH goes into circulation. This FSH acts on the ovaries, stimulates a number of eggs to develop. One of them is going to become a dominant follicle. And these follicles cause estrogen to be released. Estrogen is the female sex hormone. Estrogen goes into circulation, and it acts on all the target organs. It acts on your breasts, acts on the vagina, acts on the uterus, and it prepares you for a pregnancy. So here you are, you've had your period, the lining of the uterus has come off, you're not pregnant, and right away you start to get ready for the next cycle. And the lining of the uterus thickens in response to estrogen. Around day 14, plus or minus a day, you produce a second hormone called LH, luteinizing hormone, and luteinizing hormone is responsible for ovulation. Whereas the FSH is continuous, LH comes out from your pituitary gland in a spike, and it causes you to ovulate. Ovulate. You produce an egg. An egg comes out of the ovary. Okay, that's different. Males ejaculate. You can see it. You can feel it. You know it happened. There's no question. But ovulation, can't see it. And most of the time, you can't feel it either. Some girls do have a little bit of pain around mid-cycle, around the 14th day, again, if it's a 28-day cycle, that tells them that they're ovulating. And that pain is usually because the ovary is swollen. It's got a little cyst on it, so it may or may not hurt a little bit. And when you ovulate, the ovary actually tears. The surface of the ovary tears, and the egg comes out. And sometimes there's a little bit of bleeding at that time. And that irritates the lining of the abdomen. And you might be able to say, I can feel that I'm ovulating. It's the right time. I can feel it. I'm going to phone them to come home now. I'm ovulating. I don't care what he's doing. I don't care where he is. I need him now. Come home. Well, you don't need him that minute. You don't need him that minute. That ovulated egg survives for about 24 hours. It is fertilizable for about 24 hours. And after that, it degenerates. So the egg survives for a day. And if it's day 14, you could have sex on day 14 or day 15, or you might have had sex on day 13 because the sperm survive a little bit longer. They survive for about 48 hours. Some people say a little bit longer, a little bit less, but at least for 2 days, they can survive inside waiting to find an egg. So, a few little differences, okay? So you ovulate on day 14, and you are fertilizable, you're dangerous, for a day or two, okay? Now, males produce sperm. And we start producing sperm at around age 10, 11, 12, right? And we keep producing sperm forever. Forever. Forever means forever. The problem is the delivery system, right? That's what the problem is. Not that you're making them, you just can't deliver them. And we produce huge amounts of sperm. Huge. A normal sperm count is between, we say 40 and 150 million sperm per cc, cubic centimeter. That's a small amount. And each time you ejaculate, the amount of semen may be 2 to 3, maybe a little bit more, 2 to 3 cc's, perhaps 4, but let's say 3 cc's. So if you've got a high sperm count, around 150 million, you are producing about 500 million sperm at a time. 500 million, one egg. Now, when the sperm count gets a little bit lower, sometimes there are issues. And some people will say that the normal sperm count is 20 million, 20, 40. We're not going to argue about that. But for sure, the fertility starts to fall off as the sperm count falls off. And once in a while, I'll have people come in with an infertility problem. And I'll take a history and I'll talk to the couple. And I say, we need to do a few tests. And one of the very first tests we're going to do is we're going to do a semen analysis. We're going to do a sperm count and see what we've got. Let's see what the numbers are. And it's not just raw numbers, it's motility. Are they swimming properly? And morphology, do they look normal? Now, males produce huge amounts of sperm. And because of that, there can be lots of mistakes, right? Men are always wrong, right? Lots of mistakes. And so in any normal sperm count, we will see perhaps 25 to 30% of the sperm being non-motile or not properly motile. They're not swimming like this. They're floating. Or they're obviously dead. They're just lying there. Or they're swimming in circles. They're chasing their tails. Or they're swimming slowly as if they don't know where they really want to go. We'll see a lot of sperm that are abnormal. They don't look normal. They have broken tails. They have double heads. They've got small heads. They got big heads. They don't look normal. So there are a substantial number of sperm that have abnormal morphology. And usually 10, 15, 20% of sperm will look abnormal. So if they look abnormal and they're not swimming properly, the chances are those sperm are not going to be involved in a fertilization. Usually it's the ones that look normal, that are swimming like crazy, that are going to get where they're supposed to go. Okay? So if you've got a sperm count that's, if you're producing, let's say altogether, 100 million sperm, and 20% are not swimming, and 20% don't look normal, we're down to about 60 million. Still lots. Okay? As the sperm count falls, the fertility rate falls. The sperm have to get to the egg. That's a trick. They have a relatively, for sperm that are really tiny, they have a relatively long way to go. So let's talk a little bit about anatomy. Okay? Let's talk about anatomy. Every time you have sex, he ejaculates and he leaves behind a couple of 100 million sperm. Right? That's his gift. A couple of 100 million sperm. if they've been delivered at the right time of the month, they have a chance to get to where they're going. If they've been delivered at the wrong time of the month, they're not going to go anywhere. Because your body protects you. You are fertile for approximately 48 hours, right? That period of time around ovulation. This is day 14. So let's say day 13 and from day 13 to day 15, you are fertile. During the rest of the cycle, there is a thick mucus that blocks the cervix. And that mucus is important. It protects you. Sex is dangerous. Things can happen. You can get pregnant. You can get sick. Because those sperm are going to get into your body. Nothing gets into mine unless I stick it in. But with you, there is a route to get into your body. Through the vagina, through the cervix, through the uterus, out the fallopian tubes, and guess what? Those sperm are inside your body. Well, if sperm can get through, bacteria can get through, viruses can get through, things can happen. And you can get sick, and your body protects you by producing a thick mucus that blocks the cervix. Except on day 13, 14, 15, when the mucus thins out and becomes very watery, and sperm can now penetrate it. And after day 15, it starts to thicken up again, so sperm can't get through. So you are fertile only during that part of the month, for that roughly 48 hours. During that time, sperm can penetrate, they can swim through, and you could get pregnant. So here you are, and he delivers a couple of 100 million sperm. What happens? Within about 10 minutes, the vagina has contracted, and you have squeezed out 3/4 of the sperm. So he left you with 300 million, 250 million are gone in the first 10 minutes, and you're in the bathroom cleaning yourself up, right? Doesn't matter if you put your bum on a pillow and put it up in the air, the vagina is still going to contract, they're coming out. So huge numbers are delivered, huge numbers are wasted immediately. And a small percentage of those sperm are actually going to make it through the cervix. He left 300 million. You've still got 50 or 60 million. Some of those are going to get through the cervix and into the uterus. A lot of them are not. And so those sperm that make it through the uterus are now inside the uterus, and they have to find the openings to the fallopian tubes. All right, so let's talk about that a little bit. How big is the uterus in a girl who's never had a baby? And the answer is this big. It's the size of my thumb. It's a dinky little thing like this. And by the time this pregnancy is over, it'll be this big. And what happens is that each of the cells, each of those muscle cells of the uterus gets much larger. You don't produce more cells. You don't get more muscle cells in the uterus. Each one enlarges tremendously. Uterus gets much bigger, but at the beginning it's this size. And attached to the uterus are two fallopian tubes, one on each side. And the fallopian tube is about roughly that long, and it's not a pipe. It's not like you can stretch it out and look through it. It's a convoluted structure, and it's complex. It's complex, and those sperm have to make it through the uterus, through the fallopian tubes, and then on each side, hopefully, there's an ovary. Okay. Total distance, a couple inches, right? Maybe about 6 inches. It's not that far to go. 6 inches, not that much. And yet it's really hard for those sperm to make it that short distance. They're not transported. How do they get there? Well, they have to swim. If they were just swimming, they wouldn't make it. And they make it because the uterus is a muscle, and muscles contract and relax, and the fallopian tube has muscle in it. It also contracts. There's a little bit of fluid in there so that the sperm can swim, and there are little hair cells called cilia that are producing a current. So each time the uterus contracts, it squeezes. Those sperm that are inside the uterus have two options. They can get squeezed out, or they can get squeezed up. So they can go that distance in perhaps a couple of contractions, and the uterus is contracting all the time. You don't feel it, but it's contracting. And some girls get serious contractions at period time. They feel cramps. So a couple of contractions is sometimes enough to just push the sperm from the cervix right up to the top. And then there are two openings to the fallopian tubes. And the sperm have to now make it through the fallopian tube to the surface of the ovary. And some of them are going to go this way, and some of them are going to go that way, and some will end up in the wrong place. Is it possible for a girl who has one ovary to have children? Absolutely. That ovary will ovulate all the time. Is it possible for a girl who has one fallopian tube to get pregnant? Sure. Sperm are just going to go up that one fallopian tube. Is it possible for a girl to have an ovary on this side and no fallopian tube, and a fallopian tube on this side and no ovary? Is it possible for her to get pregnant? The answer is yes, but it's unlikely, right? Usually the sperm will go through the fallopian tube and settle on the ovary that's closest. But is it possible for them to cross over? The answer is yes, it is possible. We've seen girls who, for whatever reason, have had an ovary or a fallopian tube removed because of an ectopic pregnancy or an ovarian cyst, various situations, and still it's possible for them to have babies. Are their chances reduced? Sure. Is it possible? Yes. Okay. So here we go. Those sperm are delivered. They swim and are pushed along through the uterus and out the fallopian tube, and there they are on the surface of the ovary. How many sperm actually make it? How many sperm actually make it to the surface of the ovary so that it's possible for them to cause a fertilization? And the answer is, I don't know. Probably hundreds to low thousands, but for sure not millions. So a very small percentage of the sperm that are produced actually make it to the ovary so that an ovulation can occur, so that a fertilization can occur. Okay? All right. One egg, one sperm. They've got to get together. Here's what happens. On around day 14, you produce LH in a spike. An egg comes out, and it's ready to be fertilized. And fertilization usually takes place right then and there, on the surface of the ovary. It doesn't take place in the fallopian tube. You know, here's that egg bouncing along, says, "Come and get me, guys." That's not how it happens. The sperm are already there. You may have had sex on day 13 or on day 14, and you ovulate on day 15, and there are the sperm, and they're waiting for that egg to come out, and they attack the egg. How? We're not really sure. It may be just a chemical attraction. We're not sure exactly what happens. But the sperm, plural, attack the egg, singular. Humans have 46 chromosomes. Okay, talk a little bit about DNA. 46 chromosomes. And they're divided into pairs. We have 22 pairs. And girls have another pair. They have 23 pairs because they have two X chromosomes. And guys have 22 pairs, and they have an X chromosome and a Y chromosome. We have to have the right amount of DNA, the right numbers of chromosomes with the right amount of information for us to develop properly. When we have too much DNA, too many chromosomes, problems happen. When we have too little, problems happen. And sometimes there are problems even with the right amounts of chromosomes. But you have to have the right amount. Each egg cell has to be perfect. It for sure isn't so. I'm sure that many of the egg cells are not normal, with abnormal chromosomes, but each egg cell should have 23 chromosomes. And because you are 46XX, every egg cell you have should have an X chromosome. Some of them don't. Are they still fertilizable? Yes. If they have missing chromosomes, are they fertilizable? Probably not, but in some circumstances it's possible. But usually 23 and an X. All of our sperm cells also have 23 chromosomes. 22 autosomes and a sex chromosome, either an X or a Y. Either an X or a Y. So the males are going to determine the sex of the baby. Whatever the baby is, it's us. It's not you. Okay? So if he has 5 girls in a row, tell him he doesn't have any Y chromosomes. We determine the sex of the baby. Those chromosomes you've got to have the right numbers of chromosomes. So 23 on one side, 23 on the other, and when the sperm and the egg get together, there are 46 chromosomes. And if it's 22X and 22X, or 22 plus an X and 22 plus an X, we're going to have a girl. And if there's a Y chromosome in there, it's going to be a boy, we hope. You made a face, and I'll explain to you why we hope in a moment. Okay? So right numbers of chromosomes are extremely important. Now, the sperm, plural, attack the egg, singular. And multiple sperm will attack. And they'll get through the cytoplasm, but as they get through the outside membrane, but as they get through the nucleus, through the nuclear membrane, a chemical reaction takes place that prevents more than one sperm from getting through, so that the others are blocked, and you end up with the right numbers of chromosomes. Because if more than one sperm cell gets through to the nucleus, you have the wrong numbers of chromosomes. And either that cell will not divide at all, or it will divide a few times and then it will stop dividing. It's abnormal and nothing's going to happen. And you will never know. Okay? You'll never know. If the right number of chromosomes are there and they pair up, a normal conception has taken place. And you can't tell. You can't tell when conception takes place. It takes place ordinarily on the surface of the ovary. And now that fertilized egg has to get back into the uterus. Now, how long did it take the sperm to go this way? And the answer is probably a few hours. That's all. How long does it take the sperm to get from the vagina all the way through the uterus, through the fallopian tubes, onto the surface of the ovary? And the answer is probably a couple of hours. It's not going to happen in 30 minutes. Could it? You know what? It's possible. But probably a couple of hours. And they're there waiting for that egg to come out. Conception takes place on the surface of the ovary, and now that fertilized egg has to get back into the uterus. And it's going to take about 5 days for this to happen. So this is really quite important. What's going to happen over this period of time, and how's it going to take place, and how's the uterus going to prepare itself? Okay. You ovulated on day 14, and from that site on the ovary, that place on the ovary where the egg came out, you get a little cyst called a corpus luteum. And this corpus luteum now produces the hormone of pregnancy called progesterone. And progesterone now comes into circulation, and it acts on the uterus, on the lining of the uterus, and it starts to prepare it for a pregnancy. It starts to make